to introduce to you Jeff Johnson. Dr. Johnson is a pharmacist by training and health outcomes researcher. He's a professor in the School of Public Health at the University of Alberta, holds a Canada Research Chair in Diabetes Health Outcomes, and a Senior Health Scholar Award from the Alberta Heritage Foundation for Medical Research. Dr. Johnson is interested in diabetes surveillance and the assessment of the quality and efficiency of health care for type 2 diabetes. Dr. Johnson was recently awarded the 2008 Young Scientist Award from the Canadian Diabetes Association. He chairs the Alliance for Canadian Health Outcomes Research in Diabetes based in the Alberta Diabetes Institute. He works closely with the Public Health Agency of Canada, having served as co-chair of the Scientific Working Group for National Diabetes Surveillance System, and works with the Alberta Health and Wellness and leading the Alberta Diabetes Surveillance System. So I'm pleased to introduce Jeff to you, and he'll explain what the heck all that means, I'm sure, in the next few minutes. Jeff, thank you.
Thanks very much, Bruce. It's a pleasure to be here. I was just chatting before we got started that as a speaker, you're always worried when you get scheduled at 9 a.m. on a Saturday morning of a long weekend. So I'm really pleased, was especially pleased to see a few extra chairs being brought in, that we got a spot for everybody. My job, I think, is to get the day started with a little bit of foundation, a little bit of the landscape, as the title implies, of diabetes in Alberta. As Bruce mentioned, I work at the University of Alberta and part of the Alberta Diabetes Institute, which really is a unique and exciting place to have your research set up. My colleagues who work in the laboratories conducting basic science, all the way to the research that I conduct, which is really out in the community. And so I boast that my laboratory is actually the province of Alberta, about 700,000 square kilometers. I have the biggest lab in the whole Alberta Diabetes Institute. So what I'm talking to you about is numbers of diabetes in the province, and it's based on the Alberta Diabetes Surveillance System. And this system is really a partnership between the University of Alberta and our research group based at the Alberta Diabetes Institute and our Provincial Ministry of Health, the Alberta Health and Wellness. So it's in fact supported by our tax dollars, and I think that's really important to recognize how the government and our universities are working together and support the partnership together to help provide information about diabetes and how we're managing to look after diabetes in the province so that we can provide numbers back to those who need it to make decisions at the policy level and developing programs, but also at the delivery level. So within the primary care environment, within Alberta Health Services, we're all working together in partnership to help understand. And so what we do at the Alberta Diabetes Institute, working with the numbers, is to track the trends over time so that we can inform those who need to know, the policymakers. And as Bruce mentioned in the introduction, what we're doing here in Alberta with the diabetes surveillance system is part of a national program. So each province and territory across the country are contributing this type of information to the Public Health Agency of Canada so that on a national basis we can work together across the country to deal with and prepare for, make decisions around improving quality and efficiency of care for diabetes, for people living with diabetes. So just providing some of the numbers up front, these are some of the things, the key points that I'll show you some of the numbers. By our estimates, using information from the provincial administrative healthcare data, we estimate there's over 190,000 people living with diabetes in Alberta. It's almost over 17,000 new cases of diabetes are identified each year. That was in 2008, and we're seeing the numbers increase. Over the last decade, the numbers have more than doubled. And so these are important trends that we need to watch, and hopefully through a lot of activities, concerted efforts by people in every area, not just healthcare, but in our regular everyday lives. We can watch these trends and hopefully start to change the direction. Our system also looks at the utilization of health services, and we know from tracking over time that people living with diabetes see their physicians 2 to 3 times more often than people without diabetes, and spend 3 times as many days in hospital compared to people without diabetes. Of course, those visits to the doctors, whether they're general practitioners or specialists, are necessary and needed to look after the condition and the potential complications. But it really highlights the importance of perhaps prevention to deal with the tide of diabetes and the pressure on the healthcare system. So the more we can do to prevent the condition in the beginning, but also prevent complications and comorbid conditions from developing, we can ease some of that pressure on the healthcare system. And unfortunately, the mortality rates, the rate of death in the population living with diabetes remains twice as high as the population without diabetes. There's been some good news in terms of the trends, but the fact remains that diabetes is a condition that's associated with premature mortality in the population. So those of you who are attending this, you know the symposium, you know about diabetes, so I probably don't need to go into it in a lot of detail, but basically diabetes is a condition where the body has difficulty either producing or using the insulin that's produced in the body. And this is problematic because insulin is a hormone that's required to move glucose into the cells. Glucose is in our blood system after we eat, taking energy in, and insulin helps to move that into the cells and the organs in the body and use that for energy. When glucose remains high in the blood, that high blood glucose levels can either be acutely very high and cause acute problems, but also over a longer period of time, that accumulation results in damage to tissues. In particular, we see damage to the eyes, diabetic eye disease, damage to the kidneys. This is a person on dialysis. And also, importantly, damage to the heart and the blood vessels in the cardiovascular system. When we look at the trends in the population and when we think about diabetes, it's sometimes confusing to think about and talk about diabetes because diabetes is really a clustering of conditions, of diseases. So when we say diabetes, there's really probably more diseases that are going on than just one that we call diabetes. Type 1 diabetes is the condition that's usually associated with onset in early ages, childhood or adolescence. 12 to 14 years of age is kind of the common age at onset, sometimes a little bit earlier. This condition, which we usually associate with children, is really a small proportion of diabetes in the population. Only about 5% of all the cases with diabetes in the population in the province are type 1 diabetes. Type 2 diabetes is really the main condition that we see or we talk about when we are talking about diabetes in the population. So at the population level, which is where I have my lens on diabetes in Alberta, type 2 diabetes accounts for about 95% of the cases. And this is the condition that we're often talking about in the news that's associated with getting older, with obesity, with less physical activity, with overeating. So it's strongly associated with those lifestyle factors. And over time, developing diabetes in the early adult years, 40 and over, is historically where we looked at the trends. It's still accompanied with the major comorbidities and complications: diabetes, eye disease, heart disease, and kidney disease. But again, to emphasize, type 2 diabetes is really what we're talking about at the population level, and when we see the trends of increasing diabetes in the population, most of that is being pushed by the increasing numbers of type 2 diabetes in the population. Now, having said that, we also think that type 1 diabetes is also increasing because of the rates we look at in children, and I'll mention that as well. And diabetes, in addition to being type 1 and type 2, there's other types as well. Diabetes during pregnancy or gestational diabetes. And so it's complicated in the conditions that we're talking about, but also in all of the factors that go into increasing your risk for diabetes or complications. So increased risks of cholesterol and heart disease. Of course, I mentioned weight and lack of physical activity, but smoking as a negative health behavior and high blood pressure. So high blood pressure and elevated cholesterol, which are complicated by these lifestyle behaviors, complicate the development of diabetes and the development of complications in diabetes. So it's really a clustering of all of those risk behaviors and risk factors, not just sugar. And this is a message I try to get across in a lot of my discussions is diabetes isn't just a sugar disease. Diabetes is a clustering of risk factors: high blood pressure, overweight and obesity, high cholesterol, physical inactivity, diet, and so on. Diabetes, we often think, and it's promoted about the sugars, but really that's only one of the elements of the risk that's associated with diabetes. And the numbers that we see are staggering in some ways, and more so even the trends. But across Canada, we know that diabetes is affecting at least 6% of the adult population. In some places, it's 8, 9, 10% of the adult population. And the healthcare costs consumed are growing. So here in Alberta, we estimate that the hospital, doctors, and the emergency room costs are about $800 million a year. And what the trends are telling us is that diabetes is starting to happen earlier and earlier in life, meaning that people may live longer, but with diabetes and all the risk factors of blood pressure, obesity, and so on, the complications are arising earlier, adding to those costs. So Alberta, like almost all provinces and territories in Canada, recognizes that burden and those trends. And so a few years ago, this was 2003, our provincial government established a strategy to deal with diabetes in the province, to manage and to look at prevention, to look at high-risk populations like the Aboriginal population in the province, to support supplies and services for people with diabetes. But they also called on the establishment of a surveillance system, a way to track diabetes in the province so that we have a better understanding. So that Alberta Diabetes Strategy and our provincial government developed or supported the establishment of the surveillance system, came to our research group and said, could you help us develop that? And so over the past few years, we have been working on that. And this is a report that we did last year. We're producing another one, which will come out in 2011. We call it the Alberta Diabetes Atlas, hence the connection with the landscape and the geography. This is simply a table of contents of that. And we also have a website. This is our web address, Alberta Diabetes, fairly simple and hopefully easy to remember. But this will tell you a little bit more if you want to go look and give you some of the up-to-date numbers and on diabetes in the province, some of the numbers I'll be showing you. So what we do is present in those reports the trends over time. For example, from 1995 up until 2008, this is the number of people living with diabetes in the province. And you can see from over a decade ago, about 83,000 people living with diabetes in Alberta. And as I mentioned at the outset, almost 193,000 people living with diabetes in 2008. So we're at now 2010, so we'll be looking at a report that probably takes us out there at that same trend. Of course, our population has been growing, so we need to account for that. But we look at the numbers of people who are living with diabetes, and as I mentioned, each year we count the number of new cases. And that's followed exactly the same trend. In 1995, just under 8,000. But in 2008, we identified just over 17,000 new cases of diabetes in the province. So number of people who each year get diagnosed is increasing and has doubled in the last decade. This works out to about 43, 5 people every day identified with diabetes. Our population's been growing, so we have to kind of adjust those numbers, so the number of people that we identify might be a factor with the number of people moving in or living in the province. But if we do that, so if we take it as a rate, for every 100 people living in the province, over a decade ago it was 3.5 on average, and a couple of years ago our estimate was just over 5. So if 5 in every 100 people living in the province has diabetes. Again, doubling of the rate, and you can see the rate has been following a very straight line over the last decade. So in 2010 and beyond, we're projecting those numbers to increase at that same pace. This is an important figure that I like to, again, refer to the landscape. This is kind of how Alberta looks from the prairies to the foothills to the mountains in the BC coast. For diabetes, this is the number of people living with diabetes at each age group. So the rate, again, for every 100 people at under the age of 10, it's around 0.25. So 2 in every 1,000 children have diabetes. But if you look in the age groups of 50 to 70, it's about 1 in every 5, 20 out of every 100 people with diabetes in the ages of 50 to 70 have diabetes. So diabetes is really a disease of the aging population. And this landscape is important to remember because as we grow and as we age, our risk of diabetes increases. So as we grow physically with overweight and obesity, it increases as well. And so these are the major population trends that are pushing the numbers of diabetes. And those increasing numbers are really type 2 diabetes in the older population. We see this one blip here. This lighter green line are women in Alberta, and around the ages of 20 to 40, there's an increased risk of diabetes because of diabetes associated with pregnancy. So that little foothill in the landscape is diabetes associated with pregnancy. And if that happens, that also increases the risk of developing diabetes or diabetes continuing on into older adult ages. So trends that we watch, and this landscape is important to remember. The other reason we call this an atlas is because we present to the government, to the Alberta Health Services, to the primary care networks, how diabetes is distributed around the province. So we present in our atlas maps and color these maps based on the risk of diabetes. So in this map, the dark blue says that area of the province is much higher than the provincial average. This light green is much lower than the provincial average. So this map shows us that in northern Alberta, the prevalence of diabetes, the number of people living with diabetes per population is much higher. But in Calgary, the prevalence, the number of people living with diabetes in the population is lower than the provincial average. We can also present it this way. So again, this rate. So up to that line is the average 5.5 for every 100 people. In the south, it's a little higher than the provincial average. In the north, it's higher than the provincial average, but Calgary has lower than the provincial average. That has a lot to do with socioeconomics, with genetic risk. So in the north, the First Nations Aboriginal population that are the largest group of the population have a higher risk, and therefore we see higher rates of diabetes in that population. And I mentioned mortality rates, and this is a bit of a good news story in that over the decade, the number of people in the population dying has decreased. We are living longer, and you've, I'm sure, heard that in the news. But the population with diabetes, men or women, still remain about twice as high of a mortality rate than people without diabetes. So while there's some good news in terms of the population living longer, people with diabetes still have that increased risk of premature mortality. So we're losing life, we're losing productivity, we're losing some of our loved ones and our population. Our reports also focus on special populations. I mentioned First Nations and Aboriginal population. We also have reports on children and adolescents. So again, the rates of diabetes by the province, and you can see the numbers here. Central Alberta actually has the highest rates of diabetes in children and adolescents, and something we need to explore. The south as well. This might be to do with some of the rates of diabetes in the First Nations populations in those reserves in those areas. Northern Alberta has high Aboriginal population, but they still are very young relatively, so maybe the rates aren't there yet. But if we look at the ages, we split them up by teenage years, so 15 to 19, and here is the 1 to 4-year-olds. In fact, the increase in diabetes in these age groups under the age of 10 have grown the fastest in children and adolescents. So these children under the age of 10, it's unlikely that they have type 2 diabetes. That diabetes in that age group tends to be type 1 diabetes. So while we see the major increase in population of diabetes is around type 2, we still have to remember that type 1 diabetes, diabetes in children, is increasing as well. And this is a trend that's seen around the world. In Europe, in Finland, in France, they're also seeing increases in type 1 diabetes, which is a real challenge because we don't know really what brings type 1 diabetes on. So it's important that we watch these trends and support the research into understanding what are the risk factors, what are the triggers for type 1 diabetes, and how do we support children and families with type 1 diabetes in the population. So again, the numbers, just to remind you, reiterate the numbers, we have over 193,000 people living with diabetes. So you're here and learning more about diabetes, but you represent a very small, if you have diabetes, you represent a very small portion of the population in Alberta that has diabetes. And we need to really draw attention to the size of the population and the burden on our population, on our system, and on our healthcare system. Over 17,000 new cases each month, 43 to 45 cases every day are being identified in Alberta. And it's a costly condition, and we're seeing increasing numbers. It's going to push pressure onto our healthcare system, onto our society even more. Another good news story, just want to kind of start to end with, is our mortality rates are going down. One of the main reasons for that is that we're overcoming heart disease. We're seeing this in Alberta, we're seeing this in North America, and that has a lot to do with changing behaviors. Less smoking, a little more physical activity, better diet. So these are the numbers of people with diabetes and heart disease in Alberta over the last decade. Men with diabetes still have the highest rates of heart disease in the province, but it's gone down quite dramatically over the last decade. Women with diabetes have a higher risk of heart disease than men without diabetes in the population. So this is men and women without diabetes, and women with diabetes still have an increased risk, a substantially increased risk of heart disease. And this is really where that complication of all those lifestyle and behavioral activities come in. High blood pressure, high cholesterol are some of the most important risk factors for heart disease. And people with diabetes tend to have high blood pressure and high cholesterol. So we need to keep attention on the cholesterol and the blood pressure in diabetes, not just the sugars. And I say it's a success because those rates are going down, but actually the number of people, and this is our numbers from the Alberta Diabetes Surveillance System, the number of people with diabetes a decade ago was about 4,400, and we've kept that down or stable. And when you see the trends always going up and up and up in the population, it's heartening to see them flat or decreasing. So heart disease is one of the good news stories in overall management of diabetes in the province. But the other things we need to look at, the other complications like eye disease, we're not doing as well. This is a graph that shows in Alberta the number of people, or the proportion, who have had an eye exam for diabetic eye disease. And this on the bottom says how many years since the case has been identified. So from the first year, 1 year, 2 years, and 3 years after diabetes has been diagnosed. And this is the trend over the last decade. This was in blue, 2000 and 2004, and that was about 96, 99. After 3 years of having diabetes, only about half of the population have had an eye exam for diabetic eye disease. Our recommendations is that everybody should have one every year. Everybody with diabetes should have their eyes examined, but we're not achieving that goal in the population. So trends like this is what we feed back to the healthcare system, to the primary care doctors, to say, let's make sure we have access to eye specialists. In Alberta now, it can be an optometrist or an ophthalmologist that can do that eye exam. So we need to improve on those types of things. And I mentioned this earlier, attending physicians, people with diabetes are 2 to 3 times more likely, which is important for follow-up, but it adds to the cost for caring with people with diabetes. Fortunately, we've improved heart disease, but we still need to work more on that and reduce the risk overall. So as an individual or as a population, what can we do? Well, it's really very simple, the messaging, but it's a lot harder to really change and incorporate this into our lifestyle. But the theme of the symposium, to think healthy, to be active, to live well, those are the simple things. For people with diabetes, we often refer to the ABCs, A being A1C, a measure of your blood glucose over the past 3 months, B is blood pressure control, and C is cholesterol. So those 3 together are very, very important, and ABC is an easy way to remember it. But there's also these other things that we need to manage, to remember: healthy weights, physical activity. I tell people with diabetes, including my father, as one person, one of the most important monitoring parameters might be your waist size, your pant size, and so on. Those are markers for important risks and so on. I mentioned eye exams, and also foot exams is another monitoring parameter. Of course, if you smoke, we're always encouraging stop smoking. That's one of the major risk factors for diabetes, as well as heart disease and a lot of other health conditions. If you don't have diabetes, if you are working to prevent it, as I am, as I mentioned, my father has diabetes, so that increases my risk of developing it. So what can we do to prevent it? Again, the themes of the symposium: healthy weights, healthy living, being physically active, and having a healthy fruit and vegetable diet, following our food guide and our recommendations. Those lifestyle factors are probably the most important, of course, that we know in managing and also preventing diabetes and other chronic conditions. And the message of stop smoking will always keep putting that up. It's always, always important. So overall, I hope today helps to encourage you and support you, but the overall message, of course, is to stay healthy, to be active and have a healthy diet. Thanks very much for your attention, and enjoy the day.